Now to our GMA cover story, that new study that's sparking a lot of conversation about birth control and cancer. This is according to researchers. It can help lower your risk of ovarian cancer by almost 75% in some cases. And Dr. Jen Ashton is here to talk about that. So
good morning,
let's begin.
Robin.
Good morning to you.
Huge news for women's health and for the doctors who take care of these women. This was a big study, almost 2 million women done in Denmark, followed women for 20 years on all different types of hormonal contraception, even the newer lower dose kinds. Associated risk of ovarian cancer, which we've known in gynecology goes down when women take the pill. But these numbers were pretty impressive. Take a look at that. For anyone who's ever used hormonal contraception, lowered the risk of ovarian cancer by 34%. If they had been on the pill for 10 or more years, dropped that risk by 74%. Wow. So again, for women who have never been pregnant, for women who are in relationships with other women and say, well, I don't need the contraception, this is chemo prevention for a type of cancer that we don't have a screening test for. It's big news.
It is big news. It is, but I could have sworn that I remember that talking about the pill increases the chances of breast cancer.
You and I covered that, Robin. It came out of the same Danish registry. So listen, this is a perfect example of you cannot make this decision in a vacuum. When you talk about risk of cancer, breast versus ovarian, you have to ask, what is the relative risk? Those were the numbers I just showed. And what is the absolute risk in terms of numbers for you? Is there screening? We have a screening test for breast cancer. We do not have a screening test for ovarian cancer. And this is a decision that has to be made by that individual woman. You can't look at a body part. You have to treat the whole person. You can understand that people will go like, this is a bit confusing. So can you bottom line it for us? There's a couple of numbers that women need to know about. Number one, lifetime risk of breast cancer, as we've heard, is 1 in 8. Lifetime risk of ovarian cancer is 1 in 70. As I said, we can't screen for ovarian cancer. There is screening for breast cancer. Other things are protective for both, especially ovarian cancer. If you have been pregnant, if you had full-term pregnancies, that lowers your risk. And again, this is a decision that women need to make with their gynecologist because it depends on their age, it depends on their personal risk, and this is not one size fits all.
So many factors involved.
Absolutely.
Thank you for breaking down for us, Jen.
Robin.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.